Have you ever noticed how common it is for older adults to struggle with balance? It may look like just a normal part of aging, but the reality is far more complex. Balance is not something we usually think about until it starts to fade. It is supported by a highly coordinated system that involves your senses, muscles, joints, and brain. But what exactly changes with age that makes balance harder to maintain? Is it purely natural aging, or are there hidden factors at play? And most importantly, what can we do to prevent falls and preserve mobility? In this video, we'll break down the key reasons why balance declines, how to spot early warning signs, and the practical techniques you can use to stay steady on your feet. Stick with us until the end, because reason number 11 is extremely dangerous. And shockingly, almost no one talks about it. But before we dive into all that, if you're new here, welcome to the channel. We're here to help you live healthier, feel better, and age vibrantly. Be sure to like this video, subscribe, and turn on the notification bell so you never miss a wellness tip that could change your life. And tell us in the comments, where are you watching from? We love hearing from viewers around the world. Remember, when you give this video a like, YouTube shares it with more people, especially those who might not have access to regular medical care. So be sure to like, share, and comment to spread this knowledge to friends and family. As we age, balance declines due to a combination of physical, sensory, and neurological changes. 1. Vestibular system decline. Located in the inner ear, this system acts like a biological gyroscope. With age, its hair cells and nerve pathways deteriorate, reducing your sensitivity to head movement and spatial orientation. That's why dizziness and vertigo become more common after 60. 2. Vision loss. Conditions such as cataracts, glaucoma, and macular degeneration reduce depth perception and spatial awareness, making it harder to walk steadily. 3. Muscle and joint weakness. Aging naturally decreases muscle mass, sarcopenia, and joint flexibility. Weaker muscles slow your reaction time, making you less able to catch yourself when you trip. 4. Slower nervous system response. The central nervous system processes signals from your eyes, ears, and joints. With age, these responses slow down, so your body can't coordinate movements as quickly to maintain stability. All of these changes increase the risk of falls, one of the leading causes of hospitalization in older adults. The good news is that balance can be trained and preserved with the right exercises and lifestyle habits. 1. A sedentary lifestyle, the silent enemy. One of the biggest threats to balance is simply not moving enough. The body is designed to move. When you sit or remain inactive for long periods, muscles begin to shrink, atrophy, joints stiffen, and endurance declines. Over time, this weakens your ability to stand, walk, or react to sudden changes in position. A sedentary lifestyle also leads to weight gain, which strains your knees and hips, reduces blood circulation, which lowers oxygen delivery to muscles and the brain, increases the risk of orthostatic hypotension, a sudden drop in blood pressure when standing up, causing dizziness and instability. Scientific insight. A study published in the Journals of Gerontology found that older adults who engaged in just 150 minutes of moderate physical activity per week had up to a 40% lower risk of falls compared to sedentary individuals. Regular movement also improves proprioception, the body's ability to sense position and movement, making you less likely to trip or stumble. Regular physical activity. Simple habits like walking daily, stretching, and practicing balance-focused exercises, such as Tai Chi or yoga, can dramatically reduce fall risk. Even light activity helps preserve independence and confidence. 2. Vitamin B12 deficiency, the hidden danger. Vitamin B12 is essential for nerve health and brain function. Unfortunately, as we age, absorption of B12 from food declines, especially in people taking acid-reducing medications or those with digestive issues. A deficiency can quietly damage balance and coordination in several ways. Nerve damage. Without enough B12, the protective myelin sheath around nerves deteriorates. This disrupts communication between the brain and body, causing numbness, tingling, and impaired muscle control. Cognitive impairment. B12 deficiency has been linked to memory loss, confusion, and reduced concentration, all of which affect coordination. Anemia and fatigue. B12 is vital for producing red blood cells. Deficiency leads to anemia, which decreases oxygen supply to muscles and the brain, resulting in weakness, dizziness, and fatigue. Older adults are especially vulnerable. Yet this condition often goes unnoticed until symptoms become severe. Clinical studies have shown that up to 20% of adults over 60 suffer from vitamin B12 deficiency, often without obvious symptoms until neurological damage occurs. American Journal of Clinical Nutrition, 2013. Left untreated, the damage can be irreversible. Regularly check your B12 levels. Include B12-rich foods such as fish, eggs, dairy, and lean meats. If necessary, talk to your doctor about supplements or injections to restore levels. 3. Dehydration, the small oversight with big consequences. Dehydration is far more than just feeling thirsty. It is a silent risk factor for older adults, especially when it comes to balance and stability. With age, the body's thirst mechanism becomes blunted, meaning seniors may not feel thirsty even when their bodies desperately need fluids. This can lead to chronic, unnoticed dehydration. Complicating matters, many older adults take medications such as diuretics for high blood pressure or heart failure, which increase fluid loss. Conditions like diabetes or kidney disease can also impair the body's ability to regulate hydration. Water is essential for maintaining plasma volume, which ensures stable blood pressure and nutrient delivery to the brain and muscles. When hydration levels drop, blood volume decreases, leading to orthostatic hypotension, a sudden drop in blood pressure when standing. This is why many seniors feel dizzy or lightheaded when rising from a chair or bed. Research also links dehydration to impaired cognitive performance, increased fatigue, and muscle weakness, all of which raise fall risk. Seniors should not wait until they feel thirsty to drink. Instead, sipping small amounts of water throughout the day, adding water-rich fruits and vegetables, like cucumbers, watermelon, and oranges, and avoiding excess caffeine or alcohol are essential preventive steps. 4. Diabetes, the hidden side that affects your feet and balance. Diabetes is often thought of in terms of blood sugar numbers, but its long-term effects on balance are profound. Poorly controlled diabetes damages small nerves, a condition called peripheral neuropathy, in the feet and legs. This reduces the ability to feel pressure, texture, and vibration, key sensory inputs the brain relies on to keep the body balanced. Studies show that up to 50% of older adults with diabetes experience some form of peripheral neuropathy. Without normal nerve feedback, walking becomes riskier, as the feet cannot accurately detect uneven ground or changes in position. Additionally, diabetes can impair circulation, slowing wound healing and increasing infection risks in the feet. Hypoglycemia, low blood sugar, adds another layer of danger. When glucose supply to the brain drops, people may experience blurred vision, slowed reaction times, and confusion, all of which make falls more likely. Strict blood sugar management, daily foot inspections, supportive footwear, and regular visits to both endocrinologists and podiatrists are crucial. Seniors with diabetes should also maintain an active lifestyle, as movement helps preserve nerve function and circulation. 5. Hypotension, the hidden cause of dizziness when standing. Low blood pressure, hypotension, often flies under the radar compared to high blood pressure, but its effects can be equally dangerous for balance. Orthostatic hypotension, common in seniors, happens when blood pressure drops sharply upon standing. This reduces blood flow to the brain, causing dizziness, blurred vision, or even fainting. Normally, the autonomic nervous system quickly adjusts blood vessel tone and heart rate when posture changes. However, with aging, this reflex weakens. Medications such as antihypertensives, diuretics, or antidepressants can worsen the problem. Research shows that orthostatic hypotension doubles the risk of falls and hip fractures in older adults. Rising slowly from sitting or lying positions, staying hydrated, wearing compression stockings, and reviewing medications with a physician are practical steps. In persistent cases, doctors may recommend specific adjustments to manage blood pressure more effectively. 6. Medications, the surprising side effect you didn't expect. Medications are life-saving, but they can also silently disrupt balance. Older adults often face polypharmacy, taking multiple drugs at once, which increases the likelihood of drug interactions and side effects. Medications for high blood pressure, antidepressants, anti-anxiety drugs, sleep aids, and certain painkillers are well-documented causes of dizziness, sedation, or delayed reflexes. Research shows that seniors on 4 or more medications have a 2 to 3 times higher fall risk compared to those on fewer drugs. Aging also reduces liver and kidney efficiency, meaning drugs stay in the body longer and at higher concentrations. Regularly reviewing all prescriptions and supplements with a healthcare provider is critical. In some cases, lowering doses, switching to safer alternatives, or adjusting the timing of medication intake can reduce dizziness and instability. Importantly, no medication should be stopped abruptly without medical advice. 7. Inner ear problems. How vestibular issues can destabilize you. The vestibular system, located deep within the inner ear, acts as the body's balance command center. It integrates signals from your eyes, muscles, and joints to help you maintain stability and spatial orientation. When this system malfunctions, the brain receives distorted information, which can trigger vertigo, dizziness, unsteadiness, and blurred vision. Common vestibular disorders include benign paroxysmal positional vertigo, BPPV, labyrinthitis, and Meniere's disease. These conditions are especially frequent among older adults due to age-related degeneration of inner ear hair cells, reduced blood flow, or viral infections. Studies show that vestibular dysfunction is present in nearly 35% of people over age 40, and it's a major risk factor for falls. Symptoms often worsen during rapid head movements, making tasks like walking on uneven ground risky. Treatments range from canalith repositioning maneuvers, for BPPV, to vestibular rehabilitation therapy, which retrains the brain to compensate for balance deficits. In some cases, medications such as antihistamines or diuretics are used. Consulting an otolaryngologist, ENT, or a balance specialist is crucial for diagnosis and prevention of falls. 8. Neurological surprises, when the brain impairs balance. Balance is not just about the inner ear. It's also a brain-driven process. The brain integrates sensory input from the eyes, inner ear, and proprioceptive nerves to coordinate movement. Neurological disorders disrupt this integration, leading to instability. Parkinson's disease causes rigidity, tremors, and bradykinesia, slowness of movement. Patients often experience a stooped posture and a shuffling gait, both of which impair balance. Stroke can damage the cerebellum or motor cortex, resulting in muscle weakness, impaired coordination, or sudden loss of balance. Multiple sclerosis, MS, damages the myelin sheath surrounding nerves, slowing down signal transmission. This can lead to unpredictable episodes of weakness, fatigue, and imbalance. A review in the Lancet Neurology notes that neurological balance disorders not only increase fall risk, but also reduce independence and quality of life. Treatments include dopaminergic medications for Parkinson's, rehabilitation therapy post-stroke, and disease-modifying drugs for MS. Lifestyle adaptations, such as balance training, home modifications, and mobility aids can dramatically improve safety. 9. Rusty joints. How arthritis can hinder your daily life. With age, many people experience osteoarthritis, often called the rusting of joints. This occurs when cartilage, the protective tissue that cushions bones, gradually wears down. The result is pain, swelling, stiffness, and reduced range of motion, particularly in weight-bearing joints like the hips, knees, and spine. Arthritis reduces mobility, which paradoxically worsens the condition. Reduced movement weakens muscles and stiffens joints further, creating a vicious cycle of pain and immobility. Improper weight distribution due to painful joints can also cause compensatory movements, straining other body parts and worsening balance. Research shows that people with knee osteoarthritis are twice as likely to fall compared to those without. Management strategies include low-impact exercises, swimming, cycling, tai chi, to maintain flexibility. Weight management, which reduces joint stress. Every extra pound adds 4 pounds of pressure to the knees. Assistive devices such as canes for support. In severe cases, joint replacement surgery restores mobility. 10. Muscle weakness, the invisible challenge to your stability. Muscle weakness, especially in the legs and core, is one of the biggest hidden threats to balance. With age, sarcopenia, age-related muscle loss, becomes common, starting as early as age 40 and accelerating after 60. By 80, some individuals may lose up to 50% of their muscle mass. Weak muscles fail to properly support joints, increasing the risk of falls, fractures, and posture instability. Poor posture also alters the body's center of gravity, making balance more difficult. For instance, weak quadriceps make it hard to rise from a chair, while weak calf muscles impair walking and climbing stairs. Fortunately, research in the Journal of Gerontology shows that resistance training twice per week can significantly reverse muscle weakness in older adults, even in their 80s. Programs focusing on strength, flexibility, and balance, e.g. yoga, tai chi, or lightweight training, improve stability and confidence. Staying active is the most effective medicine for sarcopenia. 11. Hearing loss, the silent enemy of your balance. Hearing is closely linked with balance because the cochlea, hearing organ, and vestibular system share the same inner ear structures. When hearing deteriorates, the sensory signals that guide spatial awareness are also affected. Older adults with hearing loss are nearly 3 times more likely to fall, according to a study published in Archives of Internal Medicine. This happens for 2 reasons. 1. Reduced sensory input, making it harder to detect subtle environmental cues. 2. Increased cognitive load. The brain has to work harder to process sound, leaving fewer resources for balance and movement control. Hearing aids don't just restore sound. They also reduce fall risk by improving spatial orientation and environmental awareness. Regular hearing checks after age 50 are critical. 12. Declining vision. What you don't see can hurt you. Vision isn't just about seeing clearly. It is one of the body's primary balance regulators. The eyes constantly send spatial information to the brain, helping us judge distances, detect obstacles, and orient ourselves in space. When vision declines, balance control weakens, and the risk of falls increases dramatically. As we age, eye conditions become more common. Cataracts cause clouding of the eye's natural lens, reducing clarity and contrast sensitivity. Glaucoma damages the optic nerve, narrowing peripheral vision, which can make it harder to detect objects approaching from the side. Age-related macular degeneration, AMD, impairs central vision, making it difficult to recognize faces, read, or navigate safely. Scientific studies confirm that older adults with visual impairments are 2 to 3 times more likely to fall compared to those with healthy eyesight. Impaired depth perception, slower adaptation to changing light, and reduced color contrast further increase the danger, especially when walking on uneven ground or descending stairs. Regular eye exams, updated prescriptions for glasses, cataract surgery if needed, and ensuring bright, even lighting at home can drastically reduce fall risk. Key warning signs of balance problems. 1. Blurred vision. Blurry vision disrupts the brain's ability to process spatial cues. Without clear input, the body struggles to stay balanced. Causes include untreated refractive errors, cataracts, glaucoma, or even neurological issues such as stroke. Research in neurology shows that visual input accounts for over 50% of the brain's balance corrections, meaning vision clarity is critical for stability. 2. Confusion or disorientation. Cognitive changes, such as memory lapses, difficulty concentrating, or disorientation, can signal reduced blood flow to the brain or side effects of medication. Studies link impaired cognition with higher fall risk because the brain struggles to process multisensory input, vision, inner ear, proprioception. In severe cases like stroke or dementia, confusion may directly compromise balance and mobility. 3. Diarrhea and dehydration. Though unexpected, frequent diarrhea can cause fluid and electrolyte loss, especially sodium and potassium, leading to low blood pressure, dizziness, and fainting. Electrolytes play a critical role in nerve conduction and muscle contraction. Clinical evidence shows that dehydration alone can double the likelihood of dizziness-related falls in seniors. 4. Dizziness and vertigo. Dizziness is the sensation of lightheadedness, while vertigo feels like the room is spinning. Both point to disturbances in the vestibular system of the inner ear, which controls balance and spatial orientation. Conditions like benign paroxysmal positional vertigo, BPPV, Meniere's disease, or vestibular neuritis can cause these symptoms. Neurologists emphasize that vestibular dysfunction is one of the leading causes of falls in adults over 60. 5. Fear, panic, and anxiety. Emotional states directly influence balance. Anxiety triggers hyperventilation and muscle tension, which disrupts the vestibular system. Research shows that people with a fear of falling often adopt rigid movements, which ironically makes them more unstable. Psychological therapy and breathing exercises can help restore confidence and balance. 6. Sensation of falling. Some people feel as if the ground is shifting or that they are being pulled to one side, even while standing still. This may indicate inner ear disturbances or neurological conditions affecting proprioception, the body's sense of position. Such false signals confuse the brain, leading to unsteady movements and a high risk of actual falls. 7. Dizzy, faint, or floating sensations. Low blood pressure, low blood sugar, or reduced brain perfusion often cause these symptoms. For instance, orthostatic hypotension, a sudden drop in blood pressure upon standing, can briefly reduce blood flow to the brain, leading to fainting spells. Seniors with this condition are 5 times more likely to experience falls, according to geriatric studies. 8. Blood pressure changes. Blood pressure that fluctuates too much also impacts balance. A sudden drop, hypotension, causes dizziness and fainting, while chronic high blood pressure, hypertension, damages blood vessels, reducing oxygen supply to the brain. Both conditions impair stability and spatial awareness. Monitoring and managing blood pressure is therefore a cornerstone of fall prevention. Balance problems often come from a combination of sensory loss, vision, inner ear, circulation issues, blood pressure, hydration, and neurological changes. Recognizing the early warning signs, blurred vision, confusion, dizziness, or faint sensations, can prevent serious falls. Regular medical checkups, proper hydration, safe home adjustments, and lifestyle strategies are powerful tools to stay steady and independent. How to improve or recover your balance. 1. Muscle strengthening exercises. Building stronger muscles, especially in the legs, hips, and core, is the foundation of good balance. When muscles are weak, the body struggles to support itself, increasing the likelihood of falls. Exercises like squats, lunges, leg presses, and resistance band training help strengthen stabilizing muscles. Research published in the Journal of Geriatric Physical Therapy shows that seniors who consistently perform resistance training improve not only muscle mass, but also their ability to stabilize during unexpected movements, lowering fall risk significantly. Strong muscles act like shock absorbers, providing stability and control with every step. 2. Specific balance exercises. Balance-specific training helps the brain and body communicate better. Simple practices like standing on one foot, heel-to-toe walking, or balancing on an unstable surface, such as a cushion or balance board, challenge coordination and stability. These drills stimulate the vestibular system in the inner ear and the proprioceptive sensors in your joints, both of which are essential for spatial awareness. Clinical trials in older adults show that just 10 to 15 minutes of daily balance training can improve stability by up to 30%. 3. Yoga or Tai Chi. Both yoga and Tai Chi combine slow, controlled movements with mindful breathing, which enhances muscle control, flexibility, and body awareness. Yoga postures such as the tree pose or warrior pose train the body to maintain stillness while holding weight in different positions. Tai Chi, often called meditation in motion, has been scientifically shown to reduce fall rates among seniors by improving both neuromuscular coordination and mental focus. These practices also reduce cortisol, the stress hormone, which indirectly benefits balance by calming the nervous system. 4. Proprioception training. Proprioception is your body's ability to sense its position in space without looking. It's what allows you to walk in the dark without falling. Training this system through exercises like balancing on a stability ball, wobble board, or even walking with your eyes closed strengthens the nervous system's connection with your muscles. Studies in neurorehabilitation and neural repair reveal that proprioceptive training enhances reaction time and joint control, making it easier to recover quickly from slips or trips, an essential skill for fall prevention. 5. Posture improvement. Poor posture, such as slouching or leaning forward, shifts your center of gravity and destabilizes the body. Maintaining an aligned spine, relaxed shoulders, and evenly distributed weight on both feet helps your body stay balanced naturally. Postural correction reduces strain on back and leg muscles, improves circulation, and makes small adjustments in movement easier. A clinical study in Age and Aging found that posture correction programs led to measurable improvements in balance and walking speed in adults over 60. 6. Adequate hydration and diet. Hydration directly influences balance because even mild dehydration can cause dizziness, muscle cramps, and drops in blood pressure, major triggers for falls. At the same time, nutrition plays a critical role. Proteins help maintain muscle strength, calcium and vitamin D support bone health, while magnesium and B vitamins regulate nerve function. A nutrient-rich diet ensures that both muscles and the nervous system are functioning optimally, allowing for sharper coordination and stability. Balance is not just about avoiding falls. It's about training your muscles, nervous system, and even your mind to work in harmony. By combining strength training, specific balance drills, posture correction, and proper hydration and nutrition, you create a strong balance shield around your body. Have you tried any of these methods in your daily routine? Share your experience in the comments. I'd love to hear what works for you. Don't forget to like and subscribe to this channel. Thank you for watching, and see you in the next video.